Hi, everybody, and welcome to another episode of Financing Your Terms with me, Mike Benesiak. Thank you again for tuning in and for the continued shares that you guys continue to do. That was weird. All right, we'll keep going with that anyway. That's okay. That's all right. I'm not really the person here that anybody wants to listen to anyway. But thank you for the continued love, support, shares. We're good to go. We're back on track. We are wrapping up our episodes, our series on Medicare. Now's the time of year we've got to be thinking about this. This affects so many of you out there. We want to make sure you're educated, you're informed, know what's going on, and review this just like everything else in your financial life, in your life, period. It should be top of mind every single year. Even taking a quick glance or talking to an advisor like Tracy on this stuff, not only can it save you money, but you want to make sure that you're getting the coverage that you actually need for your situation. So with that being said, I'm going to turn it back over to Tracy. Tracy Hitchcock, president of Capital Benefits Group. She's been kind enough to join us here, to lend her time, but really her knowledge on everything this subject, because I couldn't tell you. I don't know. So I go to her for answers as well. We've talked about open enrollment. We've talked about rate changes, which can have a big impact on your budget. And this week, to wrap things up, we're going to talk about medical underwriting. So what do we need to know about that?
Thanks, Mike, and thanks for having me back. So yeah, this is the time of year for us to be conducting our Medicare reviews for sure. And so when we talk about the annual enrollment period, what does that truly mean? So for folks who are already in the Medicare system, what that means, it's that time of year that they have a free look to make a change with their drug cards. So if they are enrolled in a prescription drug plan, a PDP, we sit down and we look at a list of prescriptions or their current medications, and we do some comparisons to see if anything has changed over the course of the year. And then we look at where they might be enrolled for their prescription drug coverage. Each and every year, these prescription drug companies, they change premiums, they change formularies, can switch up a little bit. So it's really that opportunity for a Medicare beneficiary who has a PDP to really make a change, no questions asked. So when it comes to the annual enrollment period, you can get into a drug card plan during this time frame, and you can also make a change to your current drug card plan. Now, one of the things we like to talk about as it relates to the annual enrollment period, we like to focus a little bit on that supplement coverage. So, folks who are supplementing original Medicare benefits with a Medigap policy or a supplement policy, that type of medical plan, you can actually shop that plan at any time during the course of the year. And some folks just don't realize that. Yeah. So as it relates to your medical benefits, if you are supplementing with a Medigap policy, you have the opportunity to look at other carriers and other rates really at any time during the year. You're not limited to this annual enrollment period.
Okay.
But there is a but. The supplemental coverage, once you actually have chosen your supplement, if you want to make a change in carriers or a change in plans, you do have to go through a medical underwriting process, which means you're going to be completing a health history questionnaire with your advisor, and then you'll be submitting that to the company or carrier of your choice, and probably sitting down on the phone with a nurse case manager to do an intake on your health history. And that is what actually gives you finalized firm rates. So when it comes to Medicare supplement plans, one of the things that we just mentioned is if you're in good health or you're in moderately good health, you're not necessarily locked or tied into a specific carrier. There's movement available, and every year we move folks from carrier to carrier. But depending on your health history situation, you may be limited in terms of what options are available to you. So when it comes to annual enrollment, It's not a free look. It's not an open enrollment for Medicare supplement plans. Medical underwriting would be required for any folks who are already in the system.
Okay. So the only two questions that I have as a follow-up to that, one, does the underwriting, because I know a lot of times with life insurance, does the underwriting involve a like medical testing as well, where they come in, get your blood sample, height, weight, blood pressure, all of that, or is it just an over-the-phone interview, a health questionnaire? And then the second question is, and I don't know why I keep thinking of this, but like credit reports. If you go out and try to apply for a new credit card, they're going to pull a hard run of your credit report. Well, that can affect your credit score. So let's say you do a review, you go through this medical underwriting and come out worse than you thought. Can the current insurer that you have, even if you don't change, use that against you?
Those are awesome questions. So first question. Okay, so let's just tackle the first question. So the first question being, do you have to undergo a paramed exam, blood, urine? No, generally what we're doing is we're completing the medical questionnaire, and, there's some knockout questions, if someone has end stage renal disease or kidney failure, that's a knockout question. But generally this medical questionnaire is just going to collect current conditions, current medications, and then at the insurance carrier, there are a team of nurses, and then they will actually do intake based upon your questionnaire. If there's questions that they have, or they feel they need to request additional information from you or your physicians, that process will take place. Second question: your current carrier cannot use history information against you. Because you're already locked into basically a block of business, so that rates that you have in place are going to renew on a block basis and not at an individual level. So you're safe there.
Good. And that's, again, I've had more experience on the life insurance side, and it kind of works the same way. But one thing that be good to know that you're not at risk if you're just trying to look for a better rate, if you think there's something else that you need or can get out there. So that's wonderful. Well, I think unless there's anything else that you want to add, I think that wraps up our series. Was there anything else that you wanted to finish up on? I know we're going to add your contact info. But if people have questions, website or things like that, anything else that you'd like to finish on?
No, the only thing, Mike, thanks so much for having me. First of all, I just want to thank you for reaching out and the opportunity to get engaged. It's a really important topic, particularly because we know there are some rate increases coming in 2021. One thing I just mentioned, we talked a lot about Medicare supplements. And so before I finish up today, I just want to mention that when we do have original Medicare and a supplement, that's not the only way to protect your healthcare benefits in your senior years. So there are other options, and we do try to get as creative as possible with individuals based upon their budgets and their needs. So we talked specifically today about Medicare supplement plans and prescription drug plans, but there are Medicare cost plans in the market. There are Medicare Advantage plans in the market. So when we do see those rate increases getting to a level where it really impacts a person, especially if we're on a fixed budget, there are lots of different ways that we can attempt to get as creative as possible.
Okay, perfect. And a lot of times this would be where I'd say, hey, check out this generic, governmental website where you can find this all out. I don't, this is all such complicated stuff. So I can't stress enough how valuable it is to work with an advisor like Tracy, just to be able to answer your questions, talk about your specific case and what's going to be best. Because again, this is long-term stuff. And a lot of times you get locked in, you may have some flexibility here and there with a few things, but some things you don't. And so you really don't want to get caught in a bad situation because it could be difficult to remove yourself from that. So again, Tracy, thank you so much for taking the time. Loved having you here. This is incredibly useful information. let us know if you have questions. Let us know if you need any help from us. On my end with Finance on Your Terms, thank you again for tuning in and for supporting this channel and these series. Love to know what topics you want to hear about. Again, Medicare was very topical right now. What else is out there that you want to learn more about? Continue with the shares, continue with the likes. And we will see you next week or in the next week or two with a different series that hopefully helps you out just as much as this one. So again, thank you so much. Thanks again to Tracy with Capital Benefits Group, and we will see you next week.